According to the American Cancer Society, colon cancer in the United States is the third leading cause of cancer-related deaths in men and the fourth leading cause in women. So joining us today to talk about the importance of regular colon screening is Dr. Nimesh Naik with Dignity Health. March happens to be National Colon Cancer Awareness Month. And so, Dr. Naik, we appreciate you coming on Your Life Arizona to have this important conversation. I first want to talk about some of the guidelines with regards to screenings, because they've changed as of late, right?
Yeah, absolutely. Thanks for having me. Yes, they have changed, and it's important. Now we ask patients to get screened at 45. 45. So 5 years earlier than when they're used to. Mm-hmm. Yes, absolutely.
But you say if there's a family history even earlier than that?
Yeah, for example, if someone's father had colon cancer, their child should get screened, let's say they had it at 40, their child should get screened at 30, so 10 years before.
Okay.
Actually.
And speaking of genetics, talk to me about some of the greatest risk factors that we really should be aware of and be thinking about.
Yes, so a family history of colon cancer is always very worrisome. But there's other things: obesity, drinking alcohol, red meat intake. Those are worrisome. Mm-hmm. Age, of course. So if you've never had a colonoscopy and you're getting older, that's a risk factor as well.
What do you say to people who are like, oh, I feel healthy, I'm fine, I don't need that? What do you tell them?
That's wonderful that you feel fine, and we want you to continue to feel fine. So part of that is, get screened before it turns into an issue and becomes a problem for you.
That's right. Yeah, peace of mind is priceless, isn't it, though?
Absolutely.
Well, let's talk about some of the signs and symptoms. Heaven forbid you don't get screened and you start to experience something. What should we be on the lookout for?
There's several. The first one is, if you're having blood in your stools, that's always abnormal. Okay. That's never normal. And, often patients think that's just a hemorrhoid, and if it is, great, we can treat that too. But sometimes it's not, and that's something that really worrisome. There's other things like losing weight without trying to lose weight.
Okay.
There's changing the way your stool looks. It can get really narrow, could be really loose, could be ribbon-like. Things change from that perspective. And if you're not feeling well, go get checked out.
Got it. And at what point do we say, I'll just go see my general practitioner versus coming to see a specialist like yourself?
I think in the very beginning, you should be seeing your general practitioner at least once a year anyway.
Okay.
But if you haven't had, if there's something else particularly gone, always reach out. And if it's not something to do with the GI system or a colon system, we'll get you to where you need to be, which is the most important thing.
All righty. Before this interview, we were talking about some of the staggering statistics, some important statistics that we all should be aware of and know about when it comes to colon cancer.
Yeah, so colon cancer is the second most common type of cancer in both men and women. Third leading cause, as you mentioned, appropriately and correctly. And it's been increasing ever since, 1990, 1% to 2% each year. Last year or 2 years ago, something like 53,000 people died of colon cancer.
As I've taken some time to get to know you a little bit, your spirit is really infectious. Talk to me about, celebrating wins, because you get to do that a lot, right?
Yeah.
And tell me why.
Absolutely. I mean, colon cancer is curative. You can cure colon cancer, whether that's with surgery, whether that's with chemotherapy, or best thing ever is just get a colonoscopy and remove a polyp before it turns into cancer. And patients do well after. You see them, and it's so happy to see you can cure someone. I think that's the most important thing.
Is it fair to say that early detection is key?
Absolutely.
All right.
Absolutely.
All right. Dr. Naik, thank you so much. Really appreciate the conversation and the great information you've shared with us today. If you want more information about Dignity Health, you can check out their website. It's right there on your screen.